This year World Health Day, which is 7th of April, the theme is universal health coverage. There has been an effort in India and countries across the world to provide health care to every citizen. And universal health coverage has three broad components. One is those who are healthy, they should be kept healthy. Second component is everyone has access to essential health care. The third component is those who seek health care, they do not become impoverished because of paying for health care. So these are the three components. Every year there is an International Universal Health Coverage Day as well. 12th of December is celebrated across the world as Universal Health Coverage Day. So this year World Health Theme again highlights the importance of universal health coverage. India has been making effort in that direction. The recent effort of the government by launching National Health Protection Scheme, and the second major announcement is Health and Wellness Centers. Both these components are also referred to as IIHMR Bharat, and many people in the media also call it Modi Care. When you look at the three elements of universal health coverage, in India we have focused only on the last two elements, which is not sufficient for providing universal health coverage. The two components in India, including the high-level expert committee set up by the Planning Commission, has looked at only providing care to those who are hospitalized and financial protection alone. It is not looking at keeping those healthy, keeping those who are healthy as healthy, and it is also not looking at those who are treated in outpatient. A large proportion of patients, for example, these days, non-communicable diseases have become very common. Almost 3/4 of people who die because of non-communicable diseases, which include blood pressure, which include diabetes, which include cancers and other non-communicable diseases. Most of these patients need outpatient care, and once these conditions are there, they stay with the patient for the rest of their life. So we need to include the element of outpatient care as well, which is currently not included in National Health Protection Scheme announced by Government of India. The other issues which are raised in the media is where is the money going to come. The government has decided that 60% of financial contribution will come from the center and 40% of it will come from the states. And people often mix up that the coverage will go up to 5 lakh, so they multiply 5 lakh with the population covered, which is estimated to be 50 crores. The concept in insurance is of risk pooling. So you have to contribute maybe 1 to 2% of the total risk coverage. So financial requirement is not huge if you look at the way many people are looking at the funds required for this component. Then we often get asked what are the successful experiences within and outside India on providing universal health coverage. Outside India, public funded universal health coverage, United Kingdom is a very good example. National Health Scheme of United Kingdom provides free care to everyone in the hospital and it also includes primary health care system. So it's a very comprehensive scheme. Then you look at insurance based coverage. You can look at many countries. For example, Thailand has insurance based coverage, but there are two elements we need to keep in mind when you have insurance based coverage. One is the overhead expenditure because of running the scheme of insurance. You can either have trust run by the government, but that trust needs to incur expenditure. If you give it to private sector has to make money in addition to running the insurance scheme. So it adds to the cost. And when you are buying it from private hospital, they also need to make profit out of the healthcare they are providing. So these are the two elements when you look at insurance-based system which add to the cost. And global experience shows that insurance-based healthcare system continues to increase the cost. So that is one element we need to keep in mind when we implement National Health Protection Scheme in India, that how are we going to deal with the increase in expenditure because of engagement of insurer and also of the private sector whom we are planning to engage. Another country where we can learn from is Cuba. Again, public funded healthcare system, and if you look at expenditure about $600-700 per capita, they are able to provide very good quality of healthcare. You can look at United States, where again it is private sector provider and private companies who give insurance. A small proportion of population is paid by the government. That has one of the most expensive healthcare system in the world, and the outcomes on health are not really the best. So you can look at what these countries which are providing insurance-based health system, how the cost of expenditure is going up, so that we put in place mechanism where we can control the cost of expenditure. Within India, we have good systems in place. We can learn from Arogyashri scheme in Andhra Pradesh, in Telangana. You can look at the schemes being run in Tamil Nadu and Kerala. In addition to the essential package for the whole population, they have packages, top-up packages for those who are suffering from cancer. They have packages for those who are suffering from chronic kidney disease and need dialysis. To sum up, we need to look at a comprehensive package of universal health coverage, which includes how can we keep the population which is healthy as healthy. When you look at definition of WHO headquarters and World Bank, this element is included in the definition. But in India, we are looking at only those who fall sick, that too only those who are hospitalized, and only look at financial protection. So we need to look at universal health coverage in a comprehensive manner, and then we also need to keep in mind what are the elements which are adding to the cost. Overall, I would say Government of India has done a good thing by announcing IIHMR Bharat, but they need to look at Health and Wellness Center, rollout of Health and Wellness Center. It's been rolling out at a very slow pace. We need to expedite that and then give it a priority for the National Health Protection Scheme. Thank you.